Hello everyone, welcome to the FRAS Focus Regional Anesthesia series. I am Dr. Gopal Krishan Jalwal, Assistant Professor in Anesthesia Department. Today we will see how to perform the USG-guided Axillary Brachial Plexus block. Indication of Axillary Brachial Plexus blocks are that it can be used as a sole anesthetic agent or can be used as a post-operative analgesia purpose in elbow, forearm, and hand surgical procedures.
Here you can see the anatomy of brachial plexus at the level of the axilla. When we remove the pectoralis major and minor muscles, then you can visualize this axillary vein and axillary artery, and you can see that major uh, nerves of the nerve branches of the brachial plexus lies around these two vessels. This is the left median nerve, and here you can see this is the musculocutaneous nerve. And when we remove the axillary vein, then you can see that ulnar nerve here. This is another closer view of the brachial plexus anatomy at the level of axilla. Here also you can see that this is the axillary vein and this is the axillary artery, and around the axillary vein and artery, median nerve and other important nerves of the brachial plexus surround these two major vessels.
Sonoanatomy of axillary brachial plexus.
Let's discuss the sonoanatomy of brachial plexus at the level of axilla. When you put the high frequency linear probe in axilla, you will see these structures on your screen. Our target is to localize the axillary artery because three important nerves of brachial plexus lies around the axillary artery. Here you can see median nerve that lies superior to the axillary artery, and this is ulnar nerve that lies superior and medial side of the axillary artery. Radial nerve lies just posterior to the axillary artery. This is the axillary vein that lies just medial to the axillary artery, and most of the time when we put the probe, it can compress the axillary vein, so you have to put your probe gently so you can visualize the axillary vein. Here you can see the biceps muscle. This is the coracobrachialis. In between the biceps and coracobrachialis, this is the musculocutaneous nerve. And this is the conjoint tendon. This is the latissimus dorsi muscle. Here you can see head of the humerus.
Technique to perform the axillary brachial plexus block, patient should be placed in a supine position and arm should be abducted.
In the brachial axillary brachial plexus block, our target is to deposit the local anesthetic around the musculocutaneous nerve. Here you can see that we are depositing the local anesthetic around the musculocutaneous nerve, and it is beautifully separated from the surrounding tissue. And here this is the pulsating structure, that is the axillary artery. Okay, and now we are directing our needle superficial to the axillary artery. Here This is the a hypoechoic structure. This is the hypoechoic structure, that is the medial nerve, and on the lateral side of medial nerve, medial side of lateral nerve, there is a ulnar nerve. Here, two hypoechoic structure you can visualize here. Okay, now we are trying to deposit the local anesthetic around the axillary artery. And here you have to deposit around the 8 ml local anesthetic that is superficial to the axillary artery. Now we are directing our needle posterior to the axillary artery so that we can deposit the local anesthetic here. We have to deposit around 8 ml local anesthetic posterior to the axillary artery